Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Michael Allen, Executive VP with Open Minds, where he provides executive oversight and leadership for provider and payer client engagements. Most recently, Michael served as Chief Executive Officer of Stone Health Partners, the largest nonprofit behavioral health provider in Larimer County, Colorado. Previously, he held key leadership positions at Aspen Point, now Diversus Health, and its predecessor organizations, including roles in managed care operations, quality management, clinical supervision, and directing child welfare and substance use disorder services across multiple Colorado counties and networks. Michael, welcome.
Thank you. Thanks for having me. It's a pleasure to be here.
You know, as I mentioned to you, this is distilled from your far lengthier bio on the Open Minds site. And even that put me to the test. So I may change up my tactics and have my guests come on and give their own bios. I'm already winded. Anyway, I'm kidding. Michael, thanks so much for joining. Really do appreciate it. First, most of our listeners know about Open Minds, what you guys do. But for those who don't, if you would, tell our listeners what exactly you guys do.
Yeah. Well, first, thanks for having me. It's a pleasure to be here. And for all of you listening out there, we're glad to have you here. Open Minds is a consulting firm, a national healthcare consulting firm, actually. We've been around for almost 40 years. And we focus on the 5% of the provider organizations and vendors who work with those with chronic illnesses and chronic needs, who have more than 30% of the healthcare spend. For example, we started with substance use and mental health. Recently, about a third of our book of business has become autism and intellectual and developmental disabilities. So we really go into that space, and we're actually starting to do a lot of work into the aging space as well, based on client feedback. We're headquartered in Gettysburg, Pennsylvania, but we have consultants and leaders throughout the country. And we're happy to help businesses with a lot of their growth, their strategy, and other kind of clinical and administrative needs.
And you yourself are based where?
I'm out of Colorado. I live in Fort Collins right now, about an hour north of Denver.
Very nice. Michael, when we spoke, you described how fast the landscape for nonprofit behavioral health providers is evolving. I want to get into the various ways this change is happening. But first, what makes this current wave of change different from past disruptions in your view?
Yeah, thank you. You know, it feels like we're always talking about change, and the only constant is change. Change isn't new. I think the pace and the convergence of the forces is unprecedented. I recently heard someone say that in the last 100 years, our field of behavioral health has gone from ECT to ChatGPT, right? So there's, over 100 years,
Yeah.
we've gone through a lot. As you kind of track that, right, the only constant is change. I think the challenge is what's coming so fast, what is coming so frequently. How many executive orders have we had just in the last year alone, right? A lot. That's new, right? And so really, I think the challenge for behavioral health providers is that it's not just one policy shift. It's not Medicaid cuts, or it's not a shortage of housing. It is a combination of simultaneous restructuring of federal funding, Medicaid, housing, workforce, and technology all coming at the same time. I think we can take shots to our shields one at a time, but when all the arrows are coming at the same time, that's tough to handle.
Yeah, in our lead up to this conversation, we talked about change on two levels operating simultaneously. One is sort of the executive orders driven by this administration, and of course, it's always driven by previous or subsequent administrations. So the sort of short-term changes. Then, of course, there are more foundational, tectonic changes, systemic changes, probably the best way of looking at it. So let's first discuss some of the more temporary changes, the changes that have come on fairly recently and are probably subject themselves to change in the next 6 months, year, 3 years.
Yeah, for those, we're really looking at, mostly the changes in federal policy and federal practice, which are going to impact health providers the most. Some of those most recent ones, obviously, is the premium tax support for premiums to in the ACA and exchange plans. Those were allowed to expire. And so I think that's really going to create a lot more uninsured people without insurance coming into our providers. That one, could be reversed, obviously, with a policy change, but I think that's definitely a short term. We're talking about new pre-enrollment verification processes to receive, ACA plan exchange membership, Medicaid expansion work requirements. I think I shared recently that my daughter, who's 26, she has some physical and mental health challenges. She lives in Omaha, and she has Medicaid as her insurance. And she recently received a letter from the state Medicaid authority saying that, starting May 1st, she needed to work or volunteer 80 hours a month, for example. And, the Nebraska governor wanted to be the first out of the gate, so they're going to try this. And so we're experiencing this, as a personal level, as a dad as well. And so we're dealing with this as a family. So it's hitting at home as well as professionally. So we're experiencing this these are real people who are impacted by this.
Sure.
So these sort of policy and practice changes, I think, are some that we can see, new guidance documents coming from CMS, including health-related, social needs and Medicaid. I think there's a new executive order on homelessness and involuntary commitment, really sort of sending the message that sort of incarceration and communal housing and almost, involuntary housing is a way to deal with kind of those who are unhoused. SNAP benefit work requirements. Again, I mentioned the Medicaid work requirement. And then we're talking about, deportation of immigrant and refugee populations. Not only does this have impacts in healthcare, but where does a lot of our workforce come from? I think that's going to have our workforce challenges are going to really struggle with this, and they've already struggled. And so, we're going to have to find a new workforce when folks who have been doing jobs for us may not be able to do that. Creating the Administration for Healthy America, which replaced HRSA and SAMHSA. Lack of parity enforcement. So these kind of things, it's one of these is big, a couple of these is huge, 10 of these is really insurmountable and really difficult for providers to navigate. And this is just a sampling of some things that have come. But I would say short term, these are what I would focus on because these could be changed through policy and practice changes.
Yeah, let me remind you and let the listeners know at this point that when we spoke, we realized we were self-aware enough to realize that some of this is a bit gloom and doom. And we vowed each other that we are going, at some point, we're going to pivot and talk about some of the positive trends and things that are developing. But unfortunately, we got to stay on this topic a little bit. So now let's talk about the systemic changes, the things that are more overreach or overarching.
Yeah, I think, what we're paying attention to, and we have sort of a list of kind of 10 things that we've sort of talked to our clients about that are really market-making influence in the next year. And some of these are short-term, but a lot of them are bigger than, policy and practice changes. One big one we're focusing on is just the graying of the U.S. population. I mentioned that we're moving into sort of aging as a huge need. And I think, there's effects on the workforce when large portions of our workforce begin to retire. Health and human service demand as people age and have increased needs. And health and human service cost, right? It doesn't get cheaper as you age to, have health needs that become more expensive. So I think one of the trends we're looking at in market influences that are systemic is really we're getting older. We're getting older. And as we get older, those needs are going to increase. Again, fewer insured and more uninsured people. We are going to have some health-related social needs no longer being reimbursed by Medicaid. It's really focused specifically on behavioral health, physical health diagnoses, less on ancillary supports that we would consider, such as employment supports, vocational training, housing, food insecurity assistance. Those kind of things are really being cut quite a bit. Those feel like those are pretty systemic and will have wide-ranging impacts. I mentioned earlier that the involuntary congregate treatment as a preferred treatment model for mental illness and addictions, we saw that through the executive order last July. So we're seeing that as a pretty big market influence, again, influenced by policy. But hard to undo those things once they're institutionalized. I think we also recently saw a state challenge to community-based living requirements for people with disabilities. So I think, again, more congregate care expectations. I think we're going to see that. And again, that's when that comes into place, it's going to be hard to unwind. We're seeing a lot of changes in federal grants with defunding of grants for what are considered non-priority or non-effective interventions, such as harm reduction, housing first, things that have, in my mind, proven success and efficacy are being unwound. So those are pretty big, I would say, systemic changes that even if they change through policy or practice, will take a while to spin back up. I think the digital transformation of healthcare and the AI effect, I mean, that horse left the barn, and we could talk a little bit more about that. But really, for good or bad or better or worse, I'm not sure yet, and I'm not sure anyone has a good answer for that. There's probably other podcasts that can deal with that. But I think regardless of what you think about it, digital, healthcare is transforming. Healthcare is being transformed by the digital offerings such as AI. It's coming, whether we're ready for it or not. And so I think, that's something that's really systemic. Our health insurances and health insurers and payers are really becoming empowered, particularly through this administration, but over time have become empowered and essentially been dictating even more than federal government and states how care gets delivered, how care gets paid for. And I think that's an interesting trend that we'll need to watch that is systemic. And then finally, just immigration enforcement. So those are the 10 things that we've sort of been coaching our clients on as we look at scenarios and what could happen and how to plan strategies. Again, I'm kind of mixing the short term and
No,
systemic, but
that's
you can kind
sure.
of see what we're looking for there.
And you sort of make the implicit point that today what's changeable or what seems temporary may at some point become systemic.
Yeah, absolutely. Yeah, absolutely. Once it gets institutionalized, it's really hard to unwind those things. And so we saw that with, we're seeing that with housing first, harm reduction, a lot of the gains we've had there. I mean, once you start building congregate care, such as like prisons and, we saw this with, mental institutions, right? I mean, it's really hard to unwind that
Yeah.
without good. So, decades to do that.
Right.
And so
That
some
that
of
that
those,
that, that was sort of one of the hopes, I think, behind the ACA. The idea is that once you're able to implement something, it becomes so entrenched and institutionalized, it's really hard to claw any of it back, let alone uproot it. So
yeah,
obviously
agreed.
it kind of goes both ways in a sense. We had Monica Oss on several months back, and Monica spoke about the chaos framework, another way of dealing with this major tectonic change. I know when we spoke, you talked about the importance for scenario planning and the 6 Ps framework. So talk to that a little bit. I mean, what do you mean? What is your definition of scenario planning? Then I want to get into the 6 Ps framework, what that's all about.
Yeah. We have, I've heard from many of our clients that just sort of things are so disruptive and fast and furious. They're like, I'm just going to wait it out. Right. Which, waiting is not a strategy either. Right. And so I think that's one of the challenges that
It
we're
is a
like,
strategy, just not a
I
terribly
mean,
good one.
fair. That is absolutely fair. Yes, exactly. It's a strategy. It's not a recommended strategy. How about that? It's a better way to phrase that.
Right.
We've
Or if you're a big
encouraged.
Lebowski fan, at most it's an ethos. But go ahead, I'm sorry.
Absolutely. So I think, scenario planning is really a tool that we use to help organizations prepare for multiple futures rather than simply trying to predict a single outcome, right? So often historically, a strategic plan has said, we're going here, we're going here, we're going here, we're going to do these 5 things. And what scenario planning does is it asks what could happen and how should we respond rather than what will happen. So, and none of us have crystal balls and none of us know how it's going to happen. So it really feels like, as a former CEO, I slept at night knowing I had plans for things that I hope never happened, right? But I had a plan just in case. And that helped me be able to rest at least somewhat easy. And I think that's what we're really coaching our clients to do. Really, it's helping to identify key uncertainties. What's really most uncertain and most impactful? Is it economic conditions? Is it technology shifts? Is it regulation? And then we build distinct scenarios, 2 to 3, plausible but different scenarios based on combinations of these uncertainties. And then we stress test our strategy against that. So how does our current plan hold up against each scenario? And then from that, we develop our resources. We have contingency plans. We have early warning signals, triggers. We have, and then we can get to eventually robust strategies that work across multiple futures. So we're prepared for almost any contingency. And so, as an executive, really, the questions that we need to be asking our teams, and I asked as a CEO is, do we have the capital? Do we have the talent? Do we have the time to achieve our strategic objectives and remain financially sustainable? And if the answer is no, then we build a plan to do that. If the answer is yes, then the next question is, and if the market shifts to a new scenario, do those same still apply? And that's the essence of scenario planning is, okay, making sure we can answer that capital, talent, and time to do our strategic objectives based on any scenario that we can predict. And then asking what possible scenarios compromise that strategic position. That's the essence of strategic plan or scenario planning. Excuse me.
Yeah. Another idea you introduced when we talked about this particular thing is differentiating between probable and desirable scenarios, which it sounds like is just sort of another way of talking about what you talk about. Sort of like another way of looking at it, maybe is that old line, don't let the perfect be the enemy of the good.
Yeah, I mean, what I've found is that many boards and executive teams, and I was guilty of this myself, only focused our strategies on what we wanted to happen. But what if that doesn't happen? Or what if it's not likely to happen, right? Hope is not a strategy. I mean, not even a bad strategy. It's just not a strategy. You can't just cross your fingers, right? Doing nothing may be a strategy. Hope is not a strategy. And
No.
so what we advocate for is really, there's 6 P's that we look at, and these were borrowed, I think, from Harvard Business Review. The strategies and the scenarios are the preferable, the probable, the projected, the plausible, the possible, and the preposterous. And how we differentiate that. Preposterous sounds out there, but we've seen a lot of preposterous things, Charles. And so, I mean, it used to be that people would laugh at us when we said preposterous, and now people are pulling out their scenario plans for preposterous.
I apologize for being among those people who immediately laugh, not scoffingly, mind
that
you.
is absolutely fair. Because, I mean, before a few years ago, preposterous was really preposterous. Now, unfortunately, it's more like probable and maybe projected.
Is there anything you can think of that falls in that category?
So one recently, it was just a couple months ago when SAMHSA pulled all their grants in one day, and then the next day they reinstated them.
Voila. Oops.
I mean, who would have thought that an entire administration, a department would pull every single grant, right? And then put them back the next day. And, talking to the National Council, they had hundreds of thousands of calls from across the country, just like, what are you doing? This is really, killing people literally. And so they reinstated those. In my mind, and again, this is my opinion, I believe that they're still going to cut them. They're just learned that they're not going to do them all the same day, right?
So when you say the 6 P's and one of the P's is preposterous, what I think you're saying is that don't assume because something on its face looks preposterous that it's not a possible threat or that it's not a real threat or that it's not likely to happen.
I consider preposterous sort of what's worst case scenario. So, for example, what if all of our grant money went away in one day? That's a literal preposterous and possibly,
so in other words, it's kind
scenario.
of unthinkable until it happens.
It's unthinkable. And so what's your plan? Because you know what? It's not out of the realm of possibility.
Okay.
And so you should have a plan for that. So to answer your original question, which is, what's the difference between, probable and preferable? We would say for preferable, what I want to happen, it might not happen, but what I want to happen, that's where you get your advocacy groups involved. You lobby for that, right? That's great if it happens, but I'm not going to count on it. It's what I want. And, there's things you can do, lobby, advocacy, things like that, work with your legislators. I think where I'd put my energy is the probable and the projected. We need a plan for that. Even if it's not what you want, build the operational plan around the probable and the projected. And then so you can sleep at night prepare for the possible and the preposterous. We've seen a lot of those kind of things happening, and just, so you're bored, can sleep at night, so you can sleep at night. That's where I'd put the energy. So that's how the 5Ps works into scenario planning.
Again, when we first spoke, you suggested doubling down in investments in areas like AI. And we know, and you kind of acknowledge this, that AI can be a double-edged sword. But you suggested doubling down on investments in areas like AI and data management. Why these specifically? Are there other areas that leaders in behavioral health organizations should be doubling down on, or at a minimum, really focusing on, that they're not placing, in your view, sufficient focus currently?
Yeah, thank you. This is sort of the meat of the conversation for me around, like, how do we deal with all these? The whole conversation has been pretty negative so far. And so what's the
Right.
upside of this, right?
How
And
do we
this is where
navigate this?
I think there's some, yeah, how do we navigate this? I think there is opportunity, right? There's opportunity in any crisis. There's opportunity in any downturn, right? And so despite all the negative and disruptions and change that we're experiencing, there are those that will survive this, right? So our research shows that during 3 years after a period of market crisis and turbulence, 17% of organizations fail. 74% spent 3+ years getting back to where they are, and 9% prospered. And those that prospered embraced resilient planning, nimble portfolio management, and aggressive growth. And so why I advocate for, investments in, AI, data management, growth, those kind of things, is because I want you to be part of the 9%, right? Now is the time to be investing in your infrastructure, right? So, Open Minds has a formula that we use, a strategy that we use, which is our focus on sustainability. It's, essentially linking performance to strategy. And it starts with understanding your metrics, your organization's own performance metrics, and the metrics from the market. How are you doing compared to benchmarks? And then from there, you build your future vision. Where are we going? What does winning look like? And then you build your dashboard to have a performance driven organization, objectives that drive the strategies that you've selected, right? And you have a strategy for each key scenario. And then you do organizational performance management. You decide where to invest, where to retract. For example, some strategic initiatives that we encourage our folks to look at based on all of those things is development of integrated care approaches and programs, right? So payers are looking more toward integrated care. If you have integrated care, you are more balanced in your approach. So rather than purely mental health, purely substance use, right? You're less a target to those that are specifically targeting, for example, harm reduction programs, right? If you have a whole person care and integrated care approach, you're less likely to be cut. Improve managed care functionality with optimized revenue cycle management, right? You need to know how your billing flows through your system and how you're getting paid through managed care, including commercial payers, third-party payers, not just state, right? And private pay as well. Are you looking at consumer access and engagement? Service line development. Each service line, do you know which one's making you money, which one's losing your money, where to push on the gas, where to push on the brake, where to stop doing, what to start doing? And are you diversified enough where all your eggs aren't in one basket? And are there new revenue streams that you can expand for those that are actually creating a margin or that are pivoting from what you're currently doing? There's opportunity there. New service and technology strategy and investments. So this is the time where, if you have a workforce challenge, how can you help your clinicians be more productive and feel more empowered to spend their time with their clients, which is what they trained to do? Is there an AI solution to help them with their note taking? Is there a tech solution for helping with scheduling? Things that they never got into the business to do. Can you help them with their relationship with their clients and the people you're serving rather than with their computers? And then obviously growth, such as mergers, acquisitions, and affiliations. So these are some things that we would recommend that are invested in so you can become part of that 9% who's successful during a downturn.
It's interesting. You frame this conversation at the very outset talking about change. Change is the one constant. And, that old line, of course, the more things change, the more things stay the same. But what I'm hearing from you is not necessarily new stuff. What's new is the context. What's new is the environment. What's new taking all these things and adapting them to that new reality. So in other words, I would say the more things change, the more your fundamentals stay the same. And that doesn't mean to be, as you're describing, doesn't mean to be static, doesn't mean to be running in place. The more your fundamentals stay the same means you really not have to attend to them. You got to look at them even more carefully and understand how all of this operates within this new environment.
Yeah, absolutely. Yes, I think, what are the core basics, right? It's basic business practices, right? I think when times are good and the money's flowing in and things are happening and you have more clients than you know what to do with, we don't have to be as focused on our basics, our infrastructure, right? I made the mistake when I was a CEO. We were growing like crazy. And so we went from 200 staff in 2016 to 800 staff in 2024. But most of those I invested in clinical positions and client facing positions. And what I forgot and what I neglected was our IT system and our accounting system and our infrastructure there. And we paid the price for that. And it took a while for us to actually regain. That was me taking my eye off the ball and not really building our infrastructure to support all the clinical staff we were adding. And so, I don't know who said this either. This is a quote that I loved, but I don't know who said it, which is people need less to be taught than they need to be reminded. And I
Mhm.
think this is true. I'm not teaching anything new here. I'm trying to remind people you need to focus on the basics, right? Your infrastructure, your software, right? If you have an old electronic health record, right? Is it time to upgrade? Maybe this is the time, right? If you're using, an accounting system that doesn't talk to your payroll system, that doesn't talk to your electronic health record, is now the time, right? These are the times to invest when things may not look great on the service side, but I think now's the time to really build on your infrastructure. So when things go up, and they always do, when things go up, you are prepared to take advantage of those opportunities.
So, to the extent that this is a focus on the fundamentals, which is to say, this conversation was not that different, at least initially 5 years ago or 10 years ago, but things have changed and things have changed really, really fast. Do you find that having this conversation today, to the extent, again, that you had a similar type of conversation 5, 10, 15 years ago, do you find it's a harder conversation to have? Or people at the leadership level, because I've seen reports that there's a lot of anxiety, there's a lot of uncertainty. Will I have a job in 12 months? Will I, as a leader, have a job? Where is this all going? You have a lot of concern and legitimate concern, safety, privacy, and there are some other pretty big looming threats out there. So, what are you sensing just at a visceral level in having this conversation with leaders of these behavioral health organizations?
Speaking for Open Minds and the consulting we do, we're busier than ever. Um, and the type of engagements we're being asked to do, we get a few which are, I can't make payroll next week. Come on in, right? Those are the worst calls, right? And we get a few of those, but those have been consistent over time. I don't think we're getting more of those than we normally do. What we're getting questions is what I described earlier. Our EHR isn't keeping up with what our client needs are and what our needs of our business are. That our software doesn't talk to each other. We want you to come in and help us choose a software system that will work together. We get a lot of those kind of calls. Those are very frequent. We get a lot of calls both on the merger and acquisition side. I want to merge with someone. I want to acquire a group. And also, I want to be acquired, right? I know I'm not small. I know I'm not big enough to survive on my own. And, I believe in what we do. I don't think we can, we're not big enough to acquire anyone else. So there's that matchmaking piece that we put together. So we get a lot of requests for revenue cycle management, looking payer contracting, revenue diversification. So I guess my perspective is the conversations aren't hard. I think folks are seeing the writing on the wall and they're saying, if I don't invest right now, I may not be around to invest in the future. And I think they're seeing it as almost existential. Before it was, like maybe 5 years ago, folks were coming, and I was a client of Open Minds before I became working at Open Minds, and it was really a lot more strategic planning. It was a lot more of board work, and it was things that I would call like sort of not fluffy because it's important, but really it wasn't as much.
Keeping the lights on.
infrastructure development. Yeah, exactly. And now it's more, I feel like I need to do this or this is the end for me, right? And so it's a crisis, but it's not like urgent, like I'm going to close. It's more like I need to make these decisions in an existential way to keep my organization going. And that's for an organization that's 5 years old and, 100 years old, right? So we're seeing a lot of that. And again, that's between, I've got clients that are 5 million, I've got clients that are a billion, right? And they're all having the same conversation. So I recently worked with a client who is really, really large and asked, how big is too big? How big is big enough? And there is no good answer for that. So is a billion
Right.
big enough? It depends, right? So
We said we're going to put this on a more positive, or have a little bit more of a positive attitude here. I think it is a positive development that you're having these conversations.
yeah, it's wonderful. Yeah, I mean, I think the reception is great. I think I really am pleased with that boards and executives are seeing the need for this. I think there's less shame in asking for help, frankly. It's like, I can't do this. I need someone to come in and do this with me. And I think what I'm finding is even within competitive environments, there's quite a bit of collaboration and sharing, and I do love that. We do quite a bit of CCBHC work as well, and so I think there are new models that are helping people sort of work together as communities. And so, I'm really pleased with the sophistication of the leaders that we're able to work with who are seeing this. And despite all the negative and all the arrows and slings they're taking every day, that they're really investing for the long term for the organization, even beyond when they're gone, their organization will benefit from these decisions.
Yeah, I tell you, you were just the guy to have on to discuss this whole situation, the landscape, because you can take that 360-degree view of all of it, given all the work you've done, given the current work you're doing with Open Minds, all the companies, all the organizations you're having these conversations with. So this is a very valuable conversation. I appreciate it, Michael.
Thank you. Thank you very much.
Today, I spoke with Michael Allen, Executive VP with Open Minds, where he provides executive oversight and leadership for provider and payer client engagements. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.